Hey YouTube, it's Nicole again. I just kind of thought I would jump on here real quick and just give a little bit of update on what's going on with me and cervical cancer. So we had my benefit that I had talked about previously, and I think it was my third video. Um, yeah, in my third video, I had talked about the benefit that my mom and some friends and family and stuff that were going to put on for me. And we actually had a really good turnout. We raised over $2,000. It was a fantastic turnout, really good time. There was so much support and so many donations and just food, and so many people showed up and put money into the raffles and the 50/50s and donation jars and bought t-shirts and bracelets. It was awesome. We had such a good turnout. So I think I'm going to do another video maybe on the benefit alone, the kinds of things that were donated, the kind of raffles that we did, foods and all that kind of stuff, and kind of how we brought it all together. Maybe even a little bit of information on where I ordered like the wristbands and the t-shirts, and things like that. Just for anybody who would like to do a benefit but doesn't really know how, or just wants some ideas for it, or is just interested to know how we threw it all together in less than a month and were able to raise over $2,000. Beyond the benefit, I really wanted to come on tonight and talk because today I had my pre-op appointment, and I'm trying to think what I want to start with. So I've been having some issues the last few weeks, probably about 3 weeks now, I would say. I've been having kidney pain on and off. There for a while, it was just seemed to be consistent, and it has since died down quite a bit. But on top of the kidney pain, I was also having kind of like UTI symptoms where it feels like my bladder wasn't emptying all the way. I still actually have that right now, but the kidney pain's not so bad. But I've been feeling like my bladder doesn't empty when I go to the bathroom, and so I had done three urine samples in about the last 4 weeks. So all of them came back negative for a UTI, but 2 of the 3 showed that I actually had white blood cells, and protein in my urine. So my oncologist had ordered a CT, which I also did today. So the results of my CT came back, and everything is still within the reproductive system, reproductive organs. So hysterectomy is still a go. I do have 2 kidney stones, which they said they're not real concerned about right now. If they continue to give me problems, then we'll look into maybe doing something to dissolve them or help them pass. But for now, they're really not too concerned. They said that they're small and they look like they have broken down in size. So today I went for my pre-op testing. You know, they weighed me, they measured my height, they asked me all of my medical history, they did my blood work, they did the CT, EKG, chest x-rays were some of the things on the list that some people may have to go through for the admissions testing. The EKG was waived for me because I'm on metformin, and I took myself off of it and had stopped taking it. So and I've been off of it now for quite some time, at least a month, maybe almost 2 months. Anyway, so they weren't worried about doing the EKG since I'm not on the metformin. Apparently the metformin being on it gives them a reason to want to do the EKG. So they listened to my lungs, and for those of you that don't know, I am a smoker. I have cut down significantly since my diagnosis, and I do plan on quitting entirely. But I am a smoker, so they wanted to listen to my lungs and make sure that, just really make sure that my smoking is not going to affect my anesthesia and my lungs and those kinds of things. And I was told today that I cannot smoke for 24 hours before surgery, which I will stick to just because I'm kind of an anxious person when it comes to this kind of stuff anyways, so I really do try to follow what my doctors tell me. So that'll be a fun day for me, I'm sure, because I can't have coffee when I wake up. I can't eat, which I don't really eat in the morning, but I do like my coffee. I won't be able to smoke, the whole 9 yards. So, after listening to my lungs, they moved on to my heart, and she was listening and listening and listening, and it kind of got to the point where it was awkward. But then when I was starting to question, like, what is she listening to all this time? She was like, okay, well, I was just listening to see if I heard any kind of murmur or, arrhythmia or anything like that. And she said everything seemed fine, so I did my blood work and a couple other things they did, like a just physical exam where they checked my pulse and my wrists and at my ankles and, bend this way and, the whole routine of a regular physical. So I did all that. And basically today I got the clear to go ahead and have my surgery next week. So 1 week from today, which it's actually pretty late now, so about 6 days. So 1 week from today, anyway, 1 week from today I will be having my surgery, my hysterectomy, and I'm really just excited to be done with this chapter. They did tell me today, though, that, even after the hysterectomy, you're not done with this chapter until the pathology comes back and they clear you, and then after that, obviously you still have to have the vault smears, and you have to go so many times for the first couple years, and then so many times for the next 3 years, and then it goes to a normal amount of time, or a normal amount of exams in a regular period of time. So, really, we're not in the clear until pathology comes back. But to me, I'm feeling like we're almost done with this chapter, and I just feel so. Sorry, it was blurry a little bit, I think. Anyway, I'm just really ready to be done with this, and I know I probably shouldn't be getting my hopes up about being done, because anything could happen, and we don't know, what the pathology is going to say and all of that. But also, I had decided to cut my hair. I chopped off 14 inches. I really like it. It's not styled right now or anything. It's actually looking kind of crazy, but I cut off 14 inches, and it feels so nice now. It's it feels so healthy, and I'm not really one to go for short hair, but I was ready for a change, and my hair was so unhealthy. If you can't tell, I dye it a lot. I still have quite a bit of red in there, and then some blonde, and yeah, it's looking. And then I got my roots on top. But yeah, so I chopped off my hair, and I wasn't able to donate mine just because there's so much damage from all the dyeing and stuff. But my daughter, who just turned 5, has been begging to cut her hair. Begging and begging and begging. And I wasn't up for it. I didn't like the idea. My daughter had very long, beautiful hair. And I kept telling her, no, we're not going to cut it short. We're not going to cut it short. We're going to keep it long. Well, then when I had decided that my hair was just too unhealthy and I wanted to chop it and start over, my husband and I had kind of talked about it, and we had decided that, it wasn't fair for me to go and chop all my hair off and tell my daughter that she couldn't, pick her hairstyle. So we went and we looked online, and she picked one that she liked, and I liked it, and my husband liked it, and so we went and we both got our hair cut, and my daughter was able to donate 9 inches of her hair. And I will say that I don't think she really understood at first what that meant, but I had told her that there are some kids, because we chose wigs for kids, um, just because, and for anybody that doesn't know this, Locks of Love is not a nonprofit organization, and they do charge a significant amount for the wigs that they sell, even though the hair is donated. So, just for future reference, if you're planning on donating your hair, really try to research a nonprofit organization, as the families don't get charged absurd amounts. They basically just pay what was put into making the wigs. Yeah, so nonprofit organization, that's the way to go. Anyways, I had sat my daughter down and I had told her that some little kids get sick, and the medicine that they have to take makes their hair all fall out. And she just kind of looked at me, and I said, so there's little girls like you who sometimes they get sick, and certain medicines that they have to take to make them better makes all their hair fall out, so those little girls don't have their hair anymore. And I said, so what we'll do is we'll send in your hair, and they will make a wig so that the little girl has hair, and her hair will be made from your hair. And my daughter just thought that that was awesome. We really haven't we haven't really talked to my daughter about my illness or anything like that. She just knows that I have lots of doctor's appointments and stuff, but with her only being 5, we really haven't sat her down and had that conversation with her. And I don't really think that it's necessary to. She wouldn't understand. And once my hysterectomy's done, I'll be good to go. So, well, let's hope. I'll be good to go. So we're not going to have any kind of conversation with her about that. Maybe when she's older or something. But other than that, we will not. We haven't said anything, and we're not going to say anything to my daughter about it. So she thought it was really cool that she gets to donate her hair to sick little kids. So I encourage anybody who does, get a significant amount cut off of their hair, if it is healthy enough to donate it, please do. It's super simple. You just get the address, and you can Google nonprofit organizations that make wigs for cancer patients, and you can get the address right offline. There is usually some kind of donor form. You print it out, you fill it out, you put it in the envelope with the money, or with the hair, and you can even add money to help offset the price of the wig for whatever family would be receiving it. And you just slap a stamp on it and you mail it out. I will say though, just in case your hairdresser forgets to tell you, if the hair is wet when you get it, you have to let it sit and dry. Like, put it on a paper plate or something up out of the way, but let it dry out. Because if you put it into an envelope and seal it, it will get moldy and they will have to throw the hair away when they get it. They will not be able to use it. So that's just something to keep in mind there. I really don't have anything else going on new, other than the kidney stones, which have been a real pain in the rear lately, but it's kind of starting to subside now, which I'm liking. I have 2 12-hour shifts for work left, and then I'm off for surgery leave. I have to wash my body with an unscented antibacterial soap the night before surgery, and then the morning of surgery, and then I'll go in. I have to be there. My surgery is at 11, so I have to be there at 9 in the morning. I'll go in for surgery at 11. It's going to be around a 3-hour surgery, and then with any luck, they'll wake me up. I'll be feeling fine. I'll get through the recovery period, which will be about an hour to 2 hours, and then I should, as long as everything goes according to plan, should be able to go home the same day. So I'm excited about being able to come home and rest and heal and not have to stay in a surgery or in a hospital bed right after surgery. Much rather come home and just be comfortable and be in my own house. I don't know how everybody else is, but I get really uncomfortable, like staying in a hospital and not having a bra on, and I've got people coming in and out of my room, and maybe I'm hot, so I want to take my shirt off. Well, I can't do that because I got people coming in and out of the room, and I'm just really conservative when it comes to those kinds of things. So I would much rather be able to heal at home. I was the same way after my daughter was born. I think 26 hours after she was born, we were home and sitting on the couch because I just could not stay there. They were like, yeah, you can leave after 24 hours. And I said, yep, go ahead and start checking me out because I'm ready to go. So, other than that, I really don't have anything for you guys today. I know I haven't updated in a while. I honestly probably will not update again until after surgery. And it might be a couple days after surgery, just depending on how I'm feeling. Um, I will say, about 6 months ago, I had bought Machine Gun Kelly concert tickets um, in Columbus, Ohio for September 9th for me and my son, who is 17 now, and we're both fans of MGK, and my son's already actually seen him live with his other mom, his biological mom. He's got two moms. So, my son has actually gone and seen him with her once, and now we're going to go on Sunday, and I am so pumped, you guys. Um, it is so exciting for me to I feel like, this is my last, like, hurrah, my last something to do for me for a while, before I heal and things like that, and, I'm just super pumped, and I'm glad. For a minute we thought we were going to have to sell the tickets because we didn't know when my surgery would be and if I would be healed to go. And so Sunday, me and my son will drive down to Columbus. We will go to the Machine Gun Kelly concert, and then we will drive back home, which is about 2 hours away, maybe an hour and a half. I don't really have any sense of direction, so I really don't know, but it's about an hour and a half, 2 hours away. We'll drive home after the concert, and then I'll work Monday night. I'll be off Tuesday night, and Wednesday I will be in surgery. So I would say probably give me about a week and a half to 2 weeks, and I will try to give you guys an update on how my surgery went and things like that. Definitely try to get you at least a video of how the surgery went, how I'm feeling, like my pain levels, things of that nature. And then if I don't have it by the time I make that video, I will make a second video after this one, with my pathology results and what that means for me, and kind of my plan, per se, after that, how often I'll be going and getting my vault smears and things of that nature. So just keep an eye out. I will do my best, like I said, to update within, I'm going to say, a week of surgery. I will try to update. So 2 weeks from now, I will try to post another video before then. That's going to be my deadline. So good luck to all you ladies. And if you don't have cervical cancer, or even if you do, or if you had pre-cancer, or whatever it is, just don't forget to get your pap smears, alright? I know I wish I had gotten mine. So, alright, ladies, that's it for now. We'll talk soon. Alright, bye.